Well, an estimated 50 million people live with epilepsy, making it one of the most common neurological diseases in the world. And Dr. Keith Miller, a neurologist with Novant Health in Thomasville, joins us to talk all about that this afternoon. Good to see you.
Good to be here, thanks.
All right, so let's begin. Talk to us about epilepsy. What is it?
So epilepsy is really two or more seizures that may or may not be provoked by something else. So having a seizure can be caused by several different things. Strokes, metabolic problems, so differences in your serum sodium can do it, tumors can do it, blood around the brain can do it, so a number of different things can cause it.
All right, so what does a seizure look like, and is it possible to have a seizure and not know it?
Sure, and unfortunately that happens a lot. Many people will think of seizures as one where you fall down and shake all over. Most people aren't going to miss that one, but sometimes it could be nothing more than what I just did here.
Flicker of the eye, I noticed.
Yeah, or maybe just a little smacking of the lips or a little fumbling with the clothes. And many times you'll see that, especially like in children with absence seizures, and then they pick up like they never missed a beat, but yet they are missing periods of time, sort of like turning the TV on and turning the TV off, and then turning it back on again. And I missed something, and you have to figure out what happened in between.
And so it happens that quickly?
3 to 5 seconds sometimes. Many seizures are 1 to 3 minutes in duration. Most are not longer than that.
All right, so how do you treat something like that?
So most of the time we'll use medications, and over the past 10 years we've doubled the number of medications that are available, and that's actually obviously really helpful because medications really are very good at reducing the number of seizures as long as people take them. Now many patients sometimes can't afford their medication, they forget to take it. If I had to take something twice a day, every day for the rest of my life, I may miss a day or two, and I do that with my cholesterol medicine. Don't tell my internist that I do that, but sometimes I miss the medication, and if somebody has seizures, that may lower their threshold, make them more likely to have a seizure if they've missed their medication.
Can you help yourself if you're having a seizure, or you need to be in the room with somebody who might be recognizing that you are having one?
Sometimes you have no warning that it comes on. Sometimes you have what's known as an aura, that, ooh, I have this rising sensation, or I have a metal taste, or I have an odd smell, and with that I may then know that many times after that I will have my seizure. So if I have that sensation, I'll try to get to a safe place, maybe sit down on the ground, maybe pull my car over if I'm driving, so that I don't have one while I'm actually driving, or that I'm in an unsafe position so I can get into a safer position.
Does that mean that you need to go see a doctor once you settle down? And
notifying your doctor that you've had this event is very important so that we can assess the usefulness of the medication, if you are on medication, or do you actually need to have a workup to be evaluated for that further.
So what should people do if they want to learn more in this area?
By all means, contact your doctor, and also there's websites across the web that will be helpful for you.
All right, good stuff. Thank you so much. We appreciate you.
Thank you very much.